Hi, I'm Naomi Murphy, and this is the Locked Up Living podcast, where we talk with a wide range of people about harsh aspects of institutional life.
We also explore some of the ways to overcome them and to grow and develop. I'm David Jones. So join us every Wednesday morning, 6 o'clock UK time, for a fresh podcast. Hi. We wanted to let you know that this week's guest, Cathy Wield, also participated in the making of the film Bordering on Insanity, made by our former guest, Piers Cross. The film is being shown at the Rio Cinema in Hackney, London, and there's a special Q&A session at the Rio Cinema this coming Saturday, the 1st of March at 2 p.m. There are still a few tickets left, and you can find them online at www.riocinema.org.uk.
Today we're joined by Dr. Cathy Weild, who's a writer and speaker and has spent most of her career working in A&E. In sharing her life story, she aims to inspire hope, re-empower traumatised people and transform systems of care. And we were really lucky to get to read a copy of her forthcoming book in preparation for this podcast. Really glad you could join us today, Cathy. Welcome.
Thank you for having me.
Hello, Cathy. Very nice to meet you. So you're just about to publish a book, which is called Unshackled Mind, about your experience of the mental health system in the UK. So can you say a bit about your contact with the mental health system?
Yeah, sure. So I didn't have any contact as a patient until I was in my early 30s. So what happened was that I had triggered memories of boarding school at that time. And that came in conjunction with working, around 120 hours as a junior doctor and several sort of traumatic events in my working life. And I went to my GP, not thinking that I was depressed, but thinking that I had an understandable reaction to the circumstances. But I was diagnosed with depression. I was first put on an antidepressant and I reluctantly took it and then abandoned it pretty quickly, which again was the wrong thing to do, just suddenly stop your antidepressant. But we didn't know that. Not surprisingly, a few weeks later, nothing had got better. And so I went back and I kind of reluctantly admitted that she must be right, I must be depressed. So I was started back on an antidepressant and things just went downhill from there. Very soon I was suicidal and ended up being admitted to hospital, given ECT and put on a cocktail of various psychiatric medications. And that was the start of a 7-year continuous nightmare in and out of hospital, more and more drugs, more ECT, finally brain surgery actually, as they tried to treat my treatment-resistant depression, so-called.
Can I just ask, when you were told you had depression, were you kind of like sold that as a illness rather than it sounds like you went there thinking that you were experiencing a response to events, but actually you were persuaded that this was an illness that you had?
Oh, very much so. I mean, at the time, I wasn't aware of it, but there was the Defeat Depression campaign going on. So I'm sure my GP, along with myriad others, thought that the best thing to do was to give one of these new SSRIs. Prozac for me was the first drug. And then as time went on, I was always told I was ill, that, I had a chemical imbalance. That was definitely part of the narrative at that stage. Always told whenever they introduced a new drug or increased a dose or did something or other, that this was going to make me better, that my problem was my brain, it was ill. And in fact, the reasons I'd sought help for in the first place kind of just went into the background through this incredibly powerful narrative that I was ill.
So you mentioned the Defeat Depression campaign. Was that an actual campaign, did you find out?
Oh, yes. I mean, that was going on, I think it was between the Royal College of GPs and the Royal College of Psychiatry. So, there was a move at that stage to kind of legitimize emotional distress and, this was an illness that needed treatment, and drugs were going to do the trick. And I fell for it, hook, line and sinker. I mean, that was my background, although at that time, to actually have anything which constituted any kind of diagnosable mental illness was very much stigmatized within the profession. I'd already developed a belief that I wasn't really up to scratch, that I had a character weakness, blah, blah, blah. And so this just made it even worse.
Thank you. 7 years is an awfully long time. And as you're talking, it reminded me that, of course, Prozac was being presented as a miracle drug that we should all take, even if we didn't feel particularly depressed some years. So 7 years, and it sounds as if you were, what's the right way of pushing this? You came to think you couldn't challenge.
I mean, I never thought I could challenge it. And in fact, 7 years wasn't the end. I thought it was at the time when I had a kind of brief respite, brief being a couple of years before I was put back on antidepressants, and then went on to have, another supposed relapse and another 8 years away from work. All this time I was continuously told this is as a result of an illness. You have a problem in your brain. The only way to deal with this is drugs. I mean, ECT had been used again during the relapse, but then I was told you'll never work again. You'll never recover. You will have to take these drugs for life. You're always going to be at risk of having another serious episode and being hospitalized. So that was extremely difficult to challenge.
And whenabouts was this, Cathy?
So the first episode was 1994 to 2001. And then I was admitted to, I went back onto antidepressants, I think it was 2004. Not entirely sure. It was while I was writing the memoir about the 7 years, which was highly embarrassing. And then the next relapse was just after the memoir had been published. So I was this star patient, who'd survived all this, wonderful treatment from psychiatry. And so within a year, so that would have been end of 2006, I was admitted to hospital again. And, I just felt that a complete failure and also a fraud. And so I was then I was only in hospital for 6 months. It's crazy, but that was a short admission. And from then on, I was told all this stuff, and I was on very, very high doses of drugs. And we moved back down to England because we'd moved temporarily up to Scotland at that stage. And my husband was retraining. He decided to become a counsellor, as in, therapeutic counsellor. And he started kind of feeding me an alternative. And I started thinking, hang on a minute, these drugs aren't helping. So I started to rebel, I guess, against the treatment imposed on me. But, it took me till 2017 to finally come off the drugs. Actually, 2018 was the first time I took something.
Do you think being a doctor affected your treatment pathway?
Well, I mean, yes, it did, definitely, because I suspect they were possibly more aggressive in my treatment, certainly to begin with. But it also affected me in that when I was in hospital, actually I was subjected to a great deal of ridicule by the staff there. I got into a cycle of intense self-harm and suicidal behaviour during the first 7 years. And I was actually ended up in a locked ward with, so every ward was locked, but a secure unit. And I had a staff member with me day and night. And, I was constantly told how actually, I was being misdiagnosed as psychiatrists were obviously too kind because they persisted in saying I had treatment-resistant depression, but the nursing staff very much, or some of them, thought I had a personality disorder. And therefore, it was my fault and I didn't want to get better. And I was told these things time and time again. And actually, somebody had betrayed my confidence really quite early on. And so other patients knew I was a doctor. And they would tease me, "What's up, doc?" And then, during the brief respite when I recovered and I went back to work and I started sort of campaigning for anti-stigma and treating people better, one of the nurses said, "You should have known better." So there was this sort of dual reaction. I was definitely treated differently. I'm grateful that I never got that awful diagnosis of personality disorder, which I think is a non-diagnosis, and it's a horrible label that stops people being treated humanely. Yet, even as I was, the way people regarded you was very much as this victim who had brought it all on themselves, had some kind of duty to get better, and not getting better had to be your fault because, these treatments were there to make you better, and I wasn't getting better. They made me worse.
And you remind me as well, Cathy, that the beginning of the century was round about when the personality disorder, no longer a diagnosis of exclusion, was launched.
And it's interesting because I met people during my journey as a psychiatric patient who had that label. And I still know to this day, they're not people with personality disorders any more than anybody else. They're almost universally, I would say, the people who I came across in psychiatric hospital had a history of childhood trauma. So, for some reason, you'd been badly treated, and then it was your fault that you weren't coping with life. And the way to deal with this was to punish you further. It was quite bizarre.
Well, I think you're very brave talking about these things, Cathy, and obviously very brave writing about them as well. So, Unshackled Mind isn't your first book. What were you writing about previously?
So after the first 7 years, I was actually quite angry at what had happened. But, having realised that there was no way of dealing with that by legal means, I did actually, I think quite sensibly, decide to channel my energies into improving the attitude towards people with mental health problems as known in those terms. So I wrote Life After Darkness, which was a memoir about that 7-year period. Because of that, really. And as I say, subsequently relapsed, kind of, had blotted my copybook, as it were. And then later on, because I had also been very involved in church and Christian circles, evangelicalism since a teenager. And I realised there was also stigma in the church setting. So I wrote another book called A Thorn in My Mind, which was, I can't remember the strapline, something about stigma in the church. And again, that was to try and sort of change attitudes. But both those books really were very much at a time when I believed what I was being told, that I had a medical problem with my brain. So this third book, which I started on with some reluctance because I thought, oh no, I'm putting myself out there again. I thought I can't allow these books to be in place without actually saying no. I don't agree with what I wrote. I know it's hard, but actually I do not believe that this was a biomedical illness. I do not believe that the treatment I was given helped in any shape or form. And I need to put that out there, to put that right, because I think there are lots of people who get stuck in this cycle of despair and psychiatry and, drug after drug. And actually it's not doing them any good. And yet, I probably had one of the most extreme versions of, as a psychiatric patient. I had my brain operated on, and it is possible to come out of the other side. It is possible to turn life around again and actually to feel, because these drugs numb your emotions. I felt like I was living in 2 dimensions. And, when I started to come off these drugs, suddenly it was like, whoa, there's a world out there and it feels different. So it's supposed to be a book of hope, really.
It's a very powerful story. Well, not just this current book, Cathy, but that collection of books, actually. I think it's very powerful to set out with one tale and then change your mind about that and make that process transparent to people, because actually I think that makes it easier for other people to be curious or entertain the idea that might be another possibility or another explanation. And I suppose I was curious about how you realised that there might be alternative treatments. I mean, you mentioned your husband drip feeding little bits of information, but how did that greater exploration happen?
So, it's hard to know. So Phil had started and, he was sort of querying the biomedical model in what he was learning. And, at first I was quite resistant to it. And yet, I think we were both very scared because, I'd been told if I tried to alter my drugs, I might relapse, and hospital had been so horrendous. But then I read, actually, it was a BMJ article, which said that people died younger if they were on antipsychotic drugs, and I was on an antipsychotic drug. So I called up the person who was in charge of my care, and I said, I want to stop this. And I told him why, and he said, no, that's a bad idea. This was the drug that got you to where you are now. You're relatively well, you're out of hospital, and you might end up back. But I couldn't get it out of my head. So I decided to stop it, and I stopped it without any difficulty. And then I read a similar story about benzodiazepines and Z drugs, and I was on zolpidem. I was on these drugs which kept me awake at night. So I was having to have a sleeping tablet to help me sleep. So I thought, no, I've got to get off this. Again, I was told, but that if you don't sleep well, that's part of your relapse signature. This is serious. So I kept some, but I stopped taking them regularly. I just kind of hoarded them, I suppose, just in case. But the thing was that I became more awake, having been sleeping till midday every day. I became more awake, more able to do things, more able to engage in life. And I actually got myself back to work. So I stayed on the other 2 antidepressant drugs, very, very off-license high doses, but I had severe side effects. And it's hard to talk about on a program like this, but one of them was sexual dysfunction. I could not enjoy my sex life. I had talked to the psychiatrist and he said, well, it's got to be worth it, because, this, you're well, you're keeping well, you're doing things. And I thought, no, I'm not sure you would talk to a man like that. And I didn't believe he was sexist. I just thought, the profession is sexist. So, and I'd proved to him and to myself that if I stopped this for a few days, I could be satisfied, have an orgasm, where I could not while I was on these drugs. So I knew, because initially as well, he had told me, it's to do with your depression. So I started realizing that some of the symptoms that I'd been complaining of were drug-induced. So when I said I felt numb, I was told this was a symptom of depression. And I thought, I don't think it is. So there were various things going on where I was becoming less and less complicit, I suppose, in the biomedical narrative. And that was on top of having had a year in between the first episode and relapse, where I'd actually worked briefly in psychiatry, and I'd seen what had gone on the psychiatric ward, and I was astonished. People came in, then the psychiatrists just sat around the room discussing their symptoms and their answers to questions, And, junior doctors were there, I was there, nursing staff were there, and everyone put their oar in, and they'd come out with a diagnosis, or they'd discuss it or refute it. And I was like, my goodness, this is so random. Just depends who's around. And not only that, but it didn't seem to matter which diagnosis they had. They all got a plethora of drugs which were labelled antidepressant or antipsychotic or mood stabilizer or what have you. But it all seemed so random. And I had been told I was really unusual, that being treatment resistant was really unusual. And yet here were people who had been for years and years treated and they weren't getting better. So, all these things were playing into my mind, and I was becoming less and less in agreement with what was happening to me and psychiatry in general. And yet I had not met a single other doctor who thought anything other than the biomedical model. I hadn't met other patients who had successfully come off drugs. So I still felt alone, just like I still felt like I was the only one who'd been harmed by boarding school. So, having this sense of isolation, it was difficult for me to actually translate that into, I'm going to do something about this. But we decided to go to America. My son lived there, and I realized that I could not be on these off-license high doses. They wouldn't prescribe them, so I started to wean myself off. And as I weaned myself off, I realized that I was fine. I'd gone to work against advice, and I'd moved house, so I'd had all these stressful life events, and I'd been told, that I had to be really careful, and I was fine. So we went to the States, had an incredibly stressful settling in period, but I was still weaning off the drugs, and I didn't know anything much about withdrawal. So, that was in itself a journey. And then I took myself to see a therapist because I was always very careful, oh gosh, I might have a relapse, blah, blah, blah. And I mean, it was just astonishing. I meet this woman, and she asked me about my past. And I said, we don't need to worry about the past because I've been told that what happened in my childhood has absolutely no bearing on the mental health problems later in life. And of course, that was a stupid thing to say to a psychotherapist, red rag to a bull. And just in that first session, within that hour, I'd outlined very briefly that I'd been sent away to boarding school when I was 9. I'd been in boarding schools up until I left school at 17. I had hated every minute of it, and hadn't said anything of the detail. And it was like her jaw visibly dropped, and she went, "What do you mean?" They said it had nothing to do with it. And I said, they said it might give me vulnerability factors, and she just said, "No, you had PTSD." Now, in retrospect, I don't want another label. I'm sorry, I don't really agree with these labels, but she had just validated something which I'd been speaking of for years in various situations with therapists, with doctors, with psychiatrists, and not one of them had actually validated my experience. And she gave me a challenge. She said, if you want to work with me, you've got to be prepared to change and to think about who you are today and whether that is serving you well, whether you want to change. So I went away I couldn't even tell Phil, my husband. I have spent my life, it's had a huge impact on me, my husband, my children, my career. We've been in debt, impoverished as a result of this. And suddenly someone's telling me that actually I never had depression in the first place. So, I had been primed, as it were, to start thinking that that might be the case. And this was the time when I went, yep, she's right. It makes sense.
It's really hard not to feel angry on your behalf, Cathy. Listening to your story, not even, when you were talking about the side effects, I was thinking how often people are expected to suck up quite bad side effects. And actually, many of the men in prison used to complain about the loss of libido. And it's very easy for people to write that off and say, well, it's worth it. But actually, is it worth it? That's part of our experience, as a human being, our vitality, to have a sex drive. So actually to expect people to casually put that to one side and lose it, or people gaining huge amounts of weight, taking medication. I was also thinking about the attitude with which they persuaded you to continue with that path, because I don't know if you've read Bruce Lipton, The Biology of Belief.
No, I haven't.
It's a really good book written by a biologist, but it's very much about the placebo effect and actually how much believing that you can get better makes a difference. And they've performed heart surgery on people without anesthesia before now, and they've also opened people up and not done the surgery, and they've had the benefits as if they've had surgery. So our mind is so powerful, and so to be primed in such a way as to believe that you have to take the medication. If you're not taking the medication, what's your future going to be like? It sounds like it's had a devastating impact on had a devastating impact on your life. So yeah, it's really hard not to end up really furious. Just thinking about the boarding school, we've obviously had quite a few conversations with people who've been to boarding school. How do you think boarding school contributed to your own journey through the mental health system?
Well, again, it was very interesting because the therapist I saw in America, not only did she identify that this was a huge factor, but she also drew the parallels between my experience at boarding school and my experience as a psychiatric patient. And again, nobody had seen this. I mean, it's quite bizarre. So as a child unhappy at boarding school, which, obviously I outline in more detail in the book, I had tried to tell people and nobody had listened or nobody had heard. So, there I was going the very first time to the GP and saying, look, my memories have just been triggered, and it didn't impact her at all. And nor did it the psychotherapist. I'm not trying to blame anybody, but I think there was very much, it's a rich child's privilege. It can't possibly be that bad. But, I was admitted to hospital, put in a dormitory, which is odd. I mean, when you look back, you think, of course, I was made to eat in a dining room with everybody else, of course. I was teased and bullied by other patients and by staff. Okay, so that's boarding school again. I was trying to tell people how I felt and what was happening, and I felt unlistened to and I felt unheard. There we go again. It was regimented, there was a routine about it. But the other thing which is striking is because of my own children, I had always managed to manipulate the situation so that I was at home in the holidays for them. And then I would be admitted in the term time. So there I was, being re-traumatized time and time and time and time again by this situation. So, I mean, it had a huge impact. But I also think because of boarding school and the way particularly girls are treated, I had become somebody who tried to fit in, who tried not to rock the boat. My survival persona, as it's often called, was one that was compliant. I was used to hierarchy, particularly men being right. So I always believed that these expert doctors knew better than I did. I found it hard to challenge, and I had very low self-worth. At boarding school, you just didn't get any affirmation. And so, I was back in that situation. Every time I was under psychiatry, I was a child. I think I became the child whenever I walked into that situation. And it wasn't an adult to adult relationship. So, yeah, it was huge.
Yeah, well, very understandable. And that, I mean, we've interviewed Pierce Cross previously, who's got a film coming out next month, bordering on insanity, and I believe that you participated in that film.
Yes, yeah.
So your relationship to Christianity is also a prominent theme of the book. How do you think that influenced your acceptance of treatment?
So, I went to Christianity as an unhappy teenager at boarding school. And part of the premise was I believed I was bad. I believed I was being punished and therefore I was a sinner. I mean, everybody's flawed. But I had no core acceptance of myself as a good person. So, again, when I was given treatment, I was trying to be a good little girl. Do what the doctors tell me. But, there was a lot in doctors when they're talking about patients, they often talk about compliant and non-compliant. And, the non-compliant patients, they're trouble, they're bad, So I was trying really hard not to be a bad patient. And then the other side to it was that we were part of a church, and actually our GPs were Christians. So they were, they had prayed for me. Everybody at church had prayed for me. They're all praying for me, and I wasn't getting better. There was a very binary belief going on here. If you didn't get better, well, it couldn't be God, because God is good, so it must be you. So that just reinforced this business that I'm not getting better because it's my fault, and therefore I've sinned somewhere. So during the therapy sessions, I was like bringing out every possible thing I could think of that I'd done wrong. I was just digging deeper and deeper, trying to find all these flaws in myself. And I was very, very good at finding, the bad bits about me. Although I could never identify that I was somebody who was manipulative, because I was at that time. I was trying to get my needs met, and I was doing that. I wouldn't have been able to admit that I was open to coercion. I thought I was being incredibly open-minded. I didn't think I was good fundamentally. And so, of course, when I was suicidal, I wanted to be there for my children. I really, really didn't want to hurt them. But I actually had this belief that the world would be better off without me. And psychiatry wasn't contradicting these views. So, if I express this, nobody said, no, you are worthwhile. You are somebody it just didn't happen. There'd be, more ECT, locked you up put you in hospital. So yeah, it was very hard. And I think everything got very muddled up. And, my core beliefs were very, what's the word? I don't know. Dysfunctional. They weren't fit for purpose. And so, at the same time that I was becoming disillusioned with psychiatry, I was becoming disillusioned with evangelical church. And, and I started to understand that actually, no, I wasn't a bad person. I just believe that from a very, very young age. I did have a right to be here. Everybody does. And I could easily say that about somebody else, not about me.
Thank you. And Cathy, listening to your treatment journey, I was just wondering how you cope with that looking back. I mean, it seems to me like you've been subjected to, in a very commonplace way, not to say there's anything exceptional about what you've received, because sadly, I think it's all too common a picture, but it seems like there's dehumanization of you as a patient, a gaslighting, misunderstanding, being let down. I wonder how you cope with that, looking back and seeing what you received at that time.
I mean, I have been very angry. There have been times when I've been absolutely filled with rage, but I've also learned that that's an appropriate response. And the only way I can deal with it, I think, is in using it, sort of channeling the energy which sometimes arises from that situation and thinking, I've got to change things. I can't as an individual, so it's a question of collaborating with other people. But it's given me the energy to be able to write this book and to be able to speak out. I can only think that if something good can come, that's fantastic. I can't speak about my family and what happened to them. That's their own story, but it hurt them beyond measure. And I just hate seeing this happening. And, when I was at work in the emergency department, it just was happening time and time again. I could see this and it's horrendous. And I think, we've got to change. We've got to stop vilifying people just because they've had bad life circumstances, whatever the reason. And for me, they looked at me as a privileged person. And, in many senses I was. I had middle-class parents who were lucky enough to have my fees paid to go to boarding school. But it was paid child abuse. And there are lots of children out there who are still in that situation. There are lots of children out there in situations of poverty or other vulnerability, domestic violence or parents with alcohol abuse or those who are homeless. And none of those individuals per se are bad. They've had bad things happen to them. It doesn't mean that we're going to, tolerate criminal behavior, but I think we need to understand what's behind it. And unfortunately, I think as a society in medicine, I don't know about anywhere else much, but our tendency is to look at what's presented to us and fail to think what's brought this person to this position in their lives or to cause this behavior or is behind their addiction or what have you. And so that's become my passion.
I'm conscious, Cathy, actually, of the fact that you've spent much of your working career working in A&E, which of course often acts as the interface between people in the community and psychiatric services when people present with self-harm, for instance, and suicidal behaviour, and how often people get quite a harsh response when they turn up in these places.
Yeah, that's true. I mean, it's, there's this ridiculous sort of ladder of acceptance, there's this sort of, oh yes, they really were trying to kill themselves so we can be sympathetic. Or the people who come time and time again, as I did, they're attention seeking or, they're dysfunctional. But actually, I do think that most people who are working in these situations, they're trying to do their best. They just don't understand. So when you start educating them, and I championed what's called high intensity use now, it used to be frequent attenders. And that came out of my own experience of saying, hang on a minute, what's behind this? And actually, when people are able to stop and think, and that's difficult when it's a very busy and fraught, stressful situation. But when they do, then I think they become more human in the way they treat people. So, it's vitally important to be able to look behind what's happening and not feel threatened because you can't help them. And I think a lot of the times in healthcare services, if you can't help somebody, it's you who's feeling bad, and you need to own your own feelings instead of blaming or projecting that onto other people. And I'm not perfect in this. I've got frustrated with people when I shouldn't have. But it's time to walk away and go somewhere else and scream and chat and look at the reasons why you're feeling that.
Thank you, Cathy. It's very brave of you to write your experiences in this way. What was it like to be a doctor challenging the narrative that doctor knows best?
So, yeah, that's an interesting one, isn't it? I think it's still very alive and well. I think that doctors are given this role as experts in health. And part of the trouble is that we speak a language that most people don't understand. And it reminds me a bit of the fact that priests in the old days spoke Latin and therefore cut people out. So to actually start saying, actually, no, people know themselves well, it's not a popular concept. It's still very threatening, I think, to doctors, because, they've spent years and years studying and going through the difficulties of of being junior doctors in medical school. And, they are very suspicious of the fact that people actually might know themselves better than they know them. So it does feel a bit of an uphill struggle. And I guess we just have to keep on pushing forward. I think there's much more of an emphasis on shared decision making now. But I think to actually take down the bastion of doctor knows best is going to be baby steps, one little battle at a time.
Cathy, can I just ask, how much do you think that culture, I mean, I remember hearing about the proportion of doctors who are privately educated and also how many of them are boarding educated. And that makes me wonder, the boarding on insanity is obviously about the government being affected by boarding school culture, but I wonder to what degree that might be pervasive in the culture of medicine.
That's a very, very interesting question, because I have not heard many people admit to a boarding school education. Now, particularly at the moment, because there's some degree of reticence to actually admit students to medical school when they are from medical families. So, that they are looking at whether people from private education are entering medical school over and above those from normal, public, education. But it's interesting because when I've talked about this film, Boarding on Insanity, the only people who've contacted me who are medics who've gone to boarding school have done so privately. I agree. I don't know to what extent this has been part of the hierarchy, but I suspect it's huge. And I don't think it'll be very popular, to start suggesting that this is a bad thing to happen.
No, I suspect not. So despite the horrendous experiences you've had, your book ultimately tells a very inspirational story. Cathy, what do you hope to achieve with your book?
I suppose I want people to start thinking about what's happening in their lives if they are given a diagnostic label, or their families. I want those who care for people to start thinking about it too. I don't want to tell anybody what to do. I'm very, very aware of the fact that people must not stop their drugs suddenly, that it would be much better to be in collaboration with their doctors if they were going to decide to come off drugs. But I think it's important for people to understand that there is more to this than meets the eye, that they can go away and look at the alternatives. And, as I say, I just am aware of how I was sucked into this situation. And it took me many years to get out of it. And my fear is that there are many others like me who could actually have a much better life if they could extract themselves. So I guess my hope is that it will inspire others to just start wondering if they can think about things differently.
One of the things that we've seen over time is certainly staff within the NHS and mental health services asking the question of what happened rather than what's wrong with you. But that does also kind of go, I think, increasingly. I qualified as a clinical psychologist in the late 1990s. And at that time, to be seen by a psychologist in mental health, you didn't have to have a diagnosis. You just had to be distressed. So there was no need to give somebody a diagnosis. And it strikes me that things are really gone in the opposite direction now, that increasingly you have to meet diagnostic. That's how services define their clients, is do you meet the diagnostic criteria? And it's probably increasingly hard to avoid having a label, although probably I would hope that a lot of staff go to some lengths to explain that the label is just a description of symptoms rather than an explanation of why someone might feel they need mental health services. But it doesn't feel like a good move that to gain access you have to meet some sort of diagnosis. Is that your experience, you two?
Definitely. I think whereas asking what's happened to you is a start, I think unless there's a real fundamental understanding of the consequences of asking that question, and a move away from the belief that this is all things medical, I'm not sure how far it will get us. I think, we are still not holistic enough, and we're still, trying to fight fires by looking at what people are bringing, because people automatically go to the doctor, as I did, before turning to friends or paying for counselling or what you. And obviously the doctor is the gateway to so many services, and the labels are then gateways to services in education as well as in medicine. But it's not the right way, because we're whole people, and we do really need a community and a village to help us. And there are so many aspects to this. And one of the good things which, I was involved in with the high intensity use was that it did involve bringing in all sorts of different services, and actually people who were not qualified in anything but to just go and talk to people and befriend them. Because, there's so many complex reasons why people are distressed. But medicalising it's just putting people into a space which is already too full.
One of the things I really liked about your book, Cathy, aside from the fact it's very accessible, the story is very clearly and engagingly told, but you also offer reflections at the end of each chapter to encourage the reader to reflect on their own mental health and their own journey. Is there any other advice you'd want to give to anyone who wants to question or challenge the treatment options that they have been given?
I would definitely say don't do it while you're acutely ill. Definitely be very, very wary if you have been sectioned or detained or are currently sectioned or detained. Probably a good idea to actually start by understanding that the person who's dealing with you, doctor or therapist or nurse or what have you, that actually they really do want the best for you. They do want you to get better. They want you to get better quickly. So if their understanding isn't in alignment with yours, that actually being able to collaborate is going to be the best way, because actually coming off drugs is hard. Particularly if you've been on them for a very long time, you need to very, very carefully, because withdrawal can look like relapse. And the last thing you want is to then be, slapped with diagnosis of relapse. Yeah, so I think that's about it, really. Having an advocate, here, going online, look at AD disorder for everyone, look at MAD in the UK. Look at all the peer support that is available, antidepressant withdrawal. There are a lot of resources out there, probably there's definitely ones I haven't mentioned, but you're not alone. I think that's really, really important to understand. There are many of us, and it's very validating, isn't it?
Thank you, Cathy, and I'm glad you mentioned a disorder for everyone and MAD in the UK, because I'd made a note to make sure we make reference to them for anyone who I know you're actively involved with those organisations. So if anybody wants to understand more, I think we'll enclose a link. We'll attach links in the transcript.
Thank you very much.
Thank you.
Thanks very much indeed, Cathy. Very nice to meet you, and I think you're very courageous with talking to us and writing your book.
Thank you.